Hello everyone, and welcome to this basic overview and/or refresher of public health accreditation and what it means to our department. By the end of this video, we want you to know what accreditation is, the 12 domains of accreditation, who FAB is, the 7 steps to achieving accreditation, and what's expected of you in order for our health department to reach accredited status. But first, let's take a look at what public health accreditation is. Accreditation is an evaluation of our health department's ability to serve Butte County and improve the quality of life for residents, visitors, and those doing business in our community. Achieving accredited status declares what the health department has an appropriate mission and purpose and can demonstrate that it will continue to accomplish its mission and purpose. Our health department is going to be evaluated on our ability to fulfill the 12 domains of accreditation. Let's take a look at these domains. Domain 1. Monitor people's health. Domain 2. Investigate health problems to protect the community. Domain 3. Inform, educate, and empower people about health issues. Domain 4. Work with the community to solve health problems. Domain 5. Develop policies and plans to improve health. Domain 6. Enforce laws to protect health and ensure safety. Domain 7. Improve access to healthcare services. Domain 8. Maintain a competent public health workforce. Domain 9. Evaluate and continuously improve our department. Domain 10. Ensure the use of best practices. Domain 11. Guarantee successful operation of our department. And Domain 12. Engage our elected officials and other governing entities in public health matters. Each one of us makes some contribution, whether big or small, to carrying out the work within these 12 domains. It is important for you to know these domains and how we will fulfill them. You might be wondering who will be reviewing our health department. The Public Health Accreditation Board, better known as FAB, is responsible for assessing our department on the 12 domains of accreditation. FAB developed these domains and will use a series of measures to gauge how well we meet their standards. It is important for you to know who FAB is, as you may be asked to participate in the accreditation process more directly and may even be contacted by FAB during our evaluation. We want to reassure you that being an accredited health department is a really great achievement and provides a lot of benefits for everyone involved. Some of these include celebrating our successes and achievements, identifying opportunities for our improvement, increasing communication and collaboration within the department, providing more potential funding opportunities. Achieving accreditation lets our funders, partners, and community know that we are a trusted and high-quality organization. This process will help us focus on essential public health services, recognize the quality of services we provide, and will help improve our community's health. It's quite an accomplishment for a health department to become accredited, as only 67 departments nationwide have achieved FAB accreditation status, including our State Department of Public Health in December of 2012. Hundreds, if not thousands, of local, state, and tribal health departments are preparing to become accredited, and we are undergoing the same planning and preparation activities as we are. Now that we know what accreditation is, what the 12 domains of accreditation are, and who FAB is, let's take a look at the 7 steps our department will need to take to achieve this status. FAB accreditation process is divided into 7 distinct steps. The first step to accreditation is pre-application, a phase when the health department is preparing and getting ready to apply. We are currently in this stage of the process. FAB requires us to complete 3 prerequisites in order to become accredited. These are the Community Health Needs Assessment, or the CHA, Community Health Improvement Plan, or the CHIP, and an agency strategic plan. We just completed the CHA and have distributed the document to the community for their review and feedback. A majority of our staff participated in the process, either by attending meetings or completing the community health survey that was active in September and October of last year. The CHA describes the county's health status, defines areas for improvement, and identifies assets that can be mobilized to improve health for everyone in Butte County. The CHA is then the basis for the Community Health Improvement Plan, or the CHIP. The CHIP will outline the agreed-upon action steps to address the priority health issues and the parties responsible for implementing those steps. We anticipate that the CHIP will be completed this summer. There have been hundreds of county partners and community members also involved in the project. Our partnership is named Together We Can, Healthy Living in Butte County, and the partnership logo is under the sign here. We are also very close to completing a new strategic plan for the department. Our previous plan was developed in 2011 and will expire soon. Please be on the lookout to view the plan, as it will serve as a guide and roadmap for the department for the next 3 years. The second step is the application, where we will submit our application form and the 3 prerequisites to FAB. We hope to be able to submit our application to FAB either later this year or early next year after the 3 prerequisites are completed. The third step is documentation selection and submission. In this step, we have to demonstrate to FAB that we fulfill the 12 domains of accreditation and meet their standards. The only way to show that we fulfill the 12 domains is to submit written evidence to FAB. When applicable, you may be asked to submit samples of your projects and work as best practices to meet the FAB guidelines. We expect that it will take us about a year to select and submit all of the required documentation. The next step is the site visit. This is where a FAB-appointed peer review team will come and visit our health department and make sure our documentation meets the FAB standards and measures. Everyone, including all staff, community partners, healthcare providers, and local and state officials, will be expected to be able to answer questions about accreditation and the health department during this time. This is why it is so important for you to know who FAB is and what we will do to fulfill the 12 domains of accreditation. If our documents and site visit have been successful, we will reach the decision step and become an accredited health department. The Butte County Public Health Department will join a select group of leading health departments and will have achieved national accreditation and the benefits from it for the next 5 years. The work isn't over though. Accredited status requires continuous reporting. We must submit an annual report to FAB and continue to document our successes and services in the community. After 5 years, the Butte County Public Health Department will repeat these 7 steps to become re-accredited. Now that we know how to reach accreditation, we need to let you know what is expected of you. While only some may be asked to provide documentation to meet requirements, everyone needs to know about FAB, understand the 12 domains of accreditation, and be able to cite examples of our work that fulfill the 12 domains of accreditation. As we said earlier, FAB will visit our department for 2 to 3 days and review our work by going through the buildings and around the community, conducting interviews, and checking documentation and program validity. This means that the whole community, including internal staff, our partners, providers, and local and state officials may be questioned and must be aware of the work at the health department. Please keep a lookout for additional accreditation information and updates. Becoming an accredited health department is not easy, and it will take the teamwork and expertise of all of our staff to reach our goals. Achieving accredited status confirms that the work we do is important to our residents' well-being. The Butte County Public Health Department will be nationally recognized as a leading health department, and the community will be assured that the work we deliver produces positive health outcomes. This is an important opportunity for all of us to strengthen Butte County's health. Thank you for taking the time to learn more about our department's accreditation process. I know it's a lot of information to take in, but hope this video was informative and helpful. If you have any questions, you can contact me anytime at 538-7009 or gsbarron@buttecounty.net. Thank you for your cooperation, the outstanding work that you do, and your commitment to our department and Butte County. We will be in touch soon with further updates.